Hello everyone. Thank you for joining Family Caregiver Alliance today for this caregiving information webinar, Moving Beyond the Leakages, Practical Strategies to Manage Incontinence. I'm Leah Eskenazi with Family Caregiver Alliance, and I will be your facilitator for today's webinar. Let me give you just a little background on Family Caregiver Alliance. For over 35 years, we've been working through the San Francisco Bay Area and across the nation to improve the well-being of family and friends who are providing long-term care. We offer support through educational classes, workshops, fact sheets, retreats, and caregiver support services, research, advocacy, and more. For more information, please visit us at www.caregiver.org. There are a couple of housekeeping tasks to address prior to beginning our session today. I'd like to point out that your phones will be muted for the entire presentation, which means that you can hear us, but of course we cannot hear you. So if you have a question, and we hope that you do, please type them in the GoToMeeting question box on your screen. So again, if you have a question, please type them into your GoToMeeting question box on your screen. You can do that at any time during the presentation. At the end of the presentation, Ms. Davis will respond to your questions. Concluding this presentation, you will receive an email asking you to complete a survey about this program, and please take a moment to share your thoughts. Your feedback, of course, is very important, and it helps us shape future educational programs. So I will introduce our speaker in just a moment, but first I would also like to thank our local area agencies on aging, including the counties of Alameda, Contra Costa, San Francisco, San Mateo, and Marin for their support in making this webinar happen. And now let's welcome our speaker, Nicole Davis. Nicole?
Thank you, Leah. Hello, everyone. As Leah mentioned, I'm Nicole Davis. I'm a board-certified adult and gerontological nurse practitioner. I'm also a doctoral student at Georgia State University and a Patricia Archibald predoctoral nursing scholar. So just to give you a little bit of background, I've been a nurse for over 14 years. I've been a nurse practitioner for over 9 years in a variety of settings, and I've had the wonderful opportunity to gain a great deal of experience and expertise in urinary incontinence, working at the VA in Atlanta with the geriatrics team there. I've also lectured and published on the topic. So I'm extremely excited to speak to you today because I'm very passionate about geriatrics, also passionate about helping family caregivers. As a caregiver myself, and also someone who's worked closely with caregivers as a clinician, I can truly understand the level of dedication and sacrifice that it takes for you to do all that you do. So I sincerely applaud you. The main purpose of my discussion is to offer you some insight into urinary incontinence in the hopes that it can benefit all of you in some way. Now, although some of you may have a great deal of experience with urinary incontinence, I realize that others may not. But irregardless of that, if all of you walk away today having learned something, I really feel that our time together would have been a success. So before we get started, I'd like to just take a moment and thanks for their tireless efforts to help family caregivers and also for giving me this opportunity to speak with you today. Okay, so the burdens of incontinence. Urinary incontinence is an extremely burdensome condition, which I know really comes as no surprise to any of you. Not only is incontinence burdensome for the people who suffer with it, but it's also burdensome for those who care for them. Several studies have found that caring for someone with urinary incontinence significantly increases caregiver burden, physically because of having to toilet them, financially because of having to purchase products, and also psychologically. Caregivers that I have worked with have simply said that they no longer have time for themselves and they're up all day and all night trying to manage the incontinence. So this, of course, is especially concerning because caregivers are crucial to the delivery of home care to our older adults. The services that you provide have been valued every year at more than $300 billion. So that's how much value you bring to the healthcare system. So because of this, it's important for us as a medical community to address your burden and address your needs and provide you with the education and the support that you need. And that's really why we're here today. So our goals are to discuss the practical tips in managing urinary incontinence. We'll talk a little bit about some strategies to promote safe toileting, reduce the risk of falls, and also skin care. And then at the end, we'll briefly discuss strategies to manage the stress related to caring for someone with incontinence. There are several different definitions of urinary incontinence, but it can be simply defined as being a leakage of urine that happens outside of a person's control. There are many potential causes of urinary incontinence, so what we'll do is just briefly cover and discuss ones that you may encounter. Abnormal changes in the urinary system. There are changes that happen to the bladder and also structures in the pelvis as people age that can play a role in the development of incontinence. However, what I really want you to understand is that urinary incontinence should never be considered a normal part of getting older. Just think of it as another medical condition. Loss of mental ability is another potential cause. With this, there's a loss of an ability to understand and recognize the urge to urinate, and we see this a lot with people who have dementia or some kind of cognitive impairment. Physical disability is another potential cause. This is when a person has difficulty physically getting to the bathroom, or perhaps if they have arthritis, there's a loss of dexterity in their fingers, and that makes it difficult for them to remove their clothing or to get to the bathroom in a timely manner. Uncontrolled or undiagnosed medical conditions, for example, uncontrolled diabetes or undiagnosed congestive heart failure, things of that nature can manifest themselves as urinary incontinence. Constipation, which is a common problem in older adults, but what happens with constipation, the rectum becomes distended and filled with stool, and that distension causes pressure on the bladder, and that causes irritation and urinary symptoms, and those symptoms can lead to urinary incontinence. And then lastly, side effects of medication. Common medications like diuretics for those who have congestive heart failure, there's certain blood pressure medications, and even common over-the-counter allergy medications can make people more susceptible to urinary incontinence. So let's talk about some of the common myths that surround incontinence. So the first myth is that incontinence is a normal part of getting older. And as we just discussed, the truth is it really is not an unavoidable part of aging. It is more common in older adults, but again, don't consider it just a normal part of the aging process. So another myth is that very few people have urinary incontinence. Well, the fact is, more than 200 million people throughout the world suffer with urinary incontinence, and 17 million of those people are within the United States alone. A third myth is that drinking less fluids will help with the leakages. The fact is, limiting fluids can lead to dehydration, and that can make your bladder conditions much worse, and we'll speak a little bit to that later as well. Another myth is that nothing can be done to help urinary incontinence, when the fact is urinary incontinence is actually a treatable condition. There are several different types of incontinence, and it's usually the type of incontinence that will guide the treatment. But regardless of the type of incontinence in frail older adults, like the ones that you take care of, conservative treatments, which is what we're going to focus on today, are really considered ideal because they're low in risk. Other potential treatments of incontinence do include medications, and in some instances, surgery is an option. Another myth is that the person that I take care of, if they have urinary incontinence, that makes me a bad caregiver. and that's absolutely not true. Urinary incontinence in your care recipient really is not a direct reflection of your caregiving abilities. So I just want you to look at it in terms of, again, like I said, it's just another condition that requires your attention. Okay, so let's move on and talk a little bit about toileting and dementia. Because of the cognitive changes that happen as a result of dementia, sometimes those with the illness have less of an ability to understand and respond to the urge to urinate, and this is a type of what we call functional incontinence. Also with dementia, people are sometimes less able to understand what everyday objects are used for. So if this situation, applies to you or your loved one, I have here listed some suggestions that you can use. So firstly, you want to try to observe for toileting cues, or in other words, signs that can indicate to you that they may need to use the bathroom. Some of those signs can be restlessness or agitation. If you see them shifting in their seat or pulling on their clothes, all of those things may indicate non-verbally that they need to use the bathroom, so go ahead and try and toilet them. To help them identify the bathroom or the toilet as an appropriate place to urinate, you can paint the bathroom door or even the toilet seat cover a bright color, for example, red. It may also be helpful to remove common objects that can be mistaken for a toilet, for example, house plants or small trash cans that are around your house. And then finally, you always want to choose clothing that's easily removable, that will allow them to get to the bathroom quickly. Bathroom safety and falls. With toileting, you really want to promote independence, reduce the risk of any occur fall, or any injury that can occur to you as you're helping them. The tools listed here will do just that in terms of creating an environment that promotes independence and reducing the risk of falls or fall-associated injuries. Probably one of the most difficult in a patient's home is trying to watch a caregiver maneuver in the bathroom trying to toilet their loved one. And the reality of it is many of these bathrooms just aren't built for those purposes. So if you install something like grab bars, if you have a raised toilet seat, and also a non-skid floor mat, any of those things can be very helpful to keep you safe and also keep your loved one safe from injury. So bathroom safety and falls, this should also be considered if your loved one gets up at night to urinate. So what you want to do if they do get up at night to urinate, you of course want to maintain a well-lighted path to the bathroom. Consider using a urinal or a bedside commode. You should also try to limit fluids before bedtime. The clinic setting, we sort of use a 2 to 3 hour time period as a rule of thumb. So you can start cutting back on fluids 2 to 3 hours before bedtime with the goal of eliminating all fluids within 1 hour of going to bed. And then have your loved one empty their bladder before bedtime. Assistive transfers. If this hasn't already happened, there eventually may come a time when you have to help the person that you care for either stand or transfer to help them to toilet. Therefore, using proper body mechanics, which really means correct body positioning, can help protect you from injury. And we always want to protect you so that you can do the wonderful things that you do. So helping with transfers doesn't always really relate to physical strength, as it's more associated with aligning your body to make movements as fluid and as easily as possible. The first thing you want to do, especially if you're dealing with someone who has dementia or some sort of cognitive impairment, you just want to approach them gently and always explain what you're going to do first. A lot of times people just don't understand the importance of just taking a moment just to explain, and it can save both people a lot of aggravation if you just you can toilet them without them understanding, become resistive. So again, just approach them gently and then explain what you're going to do first. If you're transferring from the wheelchair, you want to position the wheelchair as close to the toilet as you possibly can, and always be sure to lock it. People always seem to forget that part. You never lift the person up using your back. You always want to bend your knees. What you can try and do is place your arms under their armpits so that they have something to sort of a stable place to push off from, but you don't want to pull their arms away from their shoulders. Like you have a secure grip, you push up from your legs. Now, all this is always better if you can stand close to them as much as possible. Another option would be for you to bend your legs, have them wrap their arms around your neck as if they're giving you a hug, and then pull their body gently closer to you, and then stand up that way. Once you're already standing, you want to pivot and turn your whole body. Try not to twist just one part versus the other. You want to move your body as one full unit. And then always try to have a plan ahead of time what exactly it is you're going to do, and then allow your loved one to always help if they can. And then finally, you know your limitations and know when you should ask for help. In terms of toileting in public settings, you can use these same strategies, but also take advantage of larger handicap-equipped stalls that, of course, have rear seats. They also have grab bars, so it makes the transferring that much easier. Another consideration that Leah Eskenazi had shared with me that she had heard from another caregiver states, like in the state of Oregon, there are actually stalls that have signs outside that are designated as unisex stalls so that caregivers of the opposite sex can toilet their loved ones. Now, not every state, of course, has this as an option, and with some other caregivers carry signs that they themselves stick outside of the stall toilet in their loved one. That way that decreases the anxiety for other people if they see someone of the opposite sex in that bathroom. So there's two strategies that you can use with your loved one to help improve their leakages. And the two things we're going to talk about are scheduled toileting and also prompted voiding. With scheduled toileting, the goal here is to get ahead of the leakages. And some people refer to this as toileting by the clock. What you want to do is pick a time interval. As a rule of thumb, we use every 2 hours, but if that's not really reasonable for you, you can try to go up to 3 to 4 hours, but I wouldn't go past 3 or 4 hours because that's usually when a person will need to use the bathroom anyway. But you pick a toileting interval that works best for you. Again, we'll try every 2 hours. You want to start first thing in the morning, and you have your loved one empty the bladder. And from that point on, you're going to follow the clock, and every 2 hours you'll take them to the bathroom and you toilet them. The key with this is that they need to try to urinate even if they don't feel the need, because what you're trying to do is to urinate at a frequent, go to the bathroom at a set frequency so that that decreases the chance that there's extra urine in the bladder, and that decreases the chance that there will be leakages between the toileting time points. Be sure that they empty their bladder before they leave home and also before bedtime. And if it's sort of hard because some people have difficulty keeping an eye on the clock, you're so busy and you're doing other things, another strategy that some have suggested is toileting after meals. So you would toilet after breakfast, after dinner, and then before bed. And that should pretty much cover those time points. This strategy is primarily used during the daytime hours because preferentially you'll allow the person to sleep through the night, but it also can be done during the nighttime hours as well, and that's really up to you to decide. Similar to scheduled toileting is prompted voiding, but prompted voiding is different because what you're trying to do is to change your loved one's behavior by encouraging them to be dry, and you're also trying to promote independent toileting. So with prompted voiding, you'll approach them every 2 hours and you'll ask them, are you wet or are you dry? You check their incontinence pad, and if they are dry, you give them praise in the form of verbal interaction and verbal praise. And then you try to toilet them. If they're wet when you check them, you don't give them any praise or any interaction. You don't give them any positive feedback, but be sure that you don't give them any negative feedback either. And then again, you try to toilet them. When you're toileting them, you want to try and keep the bathroom environment as relaxed as possible. You want to promote privacy. Some have suggested running a faucet in the bathroom, but sometimes that can stimulate the urge to go. And you want to try to encourage them to toilet, even if they refuse. I'd offer it maybe 3 times, and if they still refuse, then you should just say to them, okay, well, I'll be back at the next time point. Like, for example, I'll be back in 2 hours, and we'll try then. If they actually do try, then you praise them for their efforts. So the praise for successful toileting isn't really praise if they actually urinate. Praise is for them trying to urinate. So believe it or not, prompted voiding can actually be used with people who have dementia. It usually works better in people who have earlier stages of dementia. But if you're thinking, well, whether or not this works for you, studies have told us that caregivers usually do a great job identifying whether or not their loved ones could use this approach. In the nursing home setting, Auslander and colleagues identified a technique that they used to see if a person would be appropriate for prompted voiding, and they would ask them to say their name, and then if they were able to identify one of 2 objects in the room, for example, a clock, and also physically if they were able to get around independently and need minimal assistance to get to the bathroom, then they knew that that person was a candidate for prompted voiding. So that's just one strategy that you could use if you think that this would be a good idea for you and your loved one. So in conclusion, both of these techniques require persistence and training because both you and your care recipient are learning something new. It may take some time for both of you to actually get used to this, but I would encourage you to not give up. Try it for at least 3 days and then see whether or not from that point, whether or not it's something you'd want to continue. Caffeine. So you may or may not already know this, but caffeine has been known to be a bladder irritant. It's also a mild diuretic. Lately there's been some debate in the medical literature regarding the amount of caffeine that's consumed and the effects of caffeine on bladder symptoms. But what we know is that some people can be very sensitive to caffeine even in small amounts. So oftentimes in the clinic setting we encourage gradual elimination of caffeine. Now the elimination should be gradual because caffeine is notorious for causing withdrawal headaches, which some of you may or may not be familiar with. So we encourage to switch to decaf, or you can have strength coffee. So your options would be to either your goal to be switched to decaf or decrease the amount of coffee that you drink or your loved one drinks, excuse me, and see if that makes any difference. Then also I just want to point out that even though there are decaffeinated drinks and beverages and those things are acceptable, it's not totally caffeine free. Fluid management. So with incontinence, many people erroneously restrict fluid intake thinking that it would improve the incontinence. So they think if they drink less, then they'll have less leakages, and that's really not the case. When you decrease the amount of fluids, oftentimes that results in underhydration, which increases the risk of bladder infections. It can also irritate the bladder lining. And in addition to that, not enough fluids or inadequate fluid intake can result in constipation, which, as we talked about, is a common contributor to urinary incontinence in older adults. So according to the most current recommendations from the Institute of Medicine, the amount of fluid intake that a person should have for women should be about 91 ounces a day, and that's beverages and food total, and then 125 ounces for men, which equals about 8 8-ounce glasses of fluid a day. So in a clinic setting, we usually target 6 to 8 ounce glasses of fluid as a recommendation, and there have been several urinary incontinence studies that have used this behavioral approach successfully. And then again, if nighttime urination is an issue for your loved one, you again want to try and stop drinking fluids or have them stop drinking fluids 2 to 3 hours before bedtime. Here are a list of common bladder irritants. I would suggest that you try to limit dietary exposure to any of these as much as possible. And if the person that you care for consumes a large amount of these or several items on this list, one approach would be to try and eliminate one at a time and see if that makes any difference. But we have listed here artificial sweetener, spicy food, tomato-based food, citrus products, carbonated drinks, and also alcohol. As we discussed before, chronic constipation again can cause urinary symptoms which lead to incontinence. Now here are a list of several over-the-counter remedies, and although they can be helpful in the short term, for example for a few days, longer-term use of these things can cause significant problems, which are listed here. One effective approach is to increase the dietary intake of fiber. The current recommendations are that the normal amount of fiber that's needed in the U.S. diet is anywhere between 25 to 35 grams per day, and most people or adults within our country only get about half of that in. So one approach is to increase your dietary intake of fiber because fiber will help promote evacuation of the stool. Here's a recipe that we call a constipation recipe in the clinic, but we've used it successfully and many patients have sworn by it. So what you want to do is take 1 cup of crushed 100% bran flakes. You can also use Fiber One cereal. You want to mix that with 1.5 cups of canned pears and real juice. For whatever reason, it's very important that it's in real juice. It doesn't seem to work as effectively if it's in some type of a syrup. You blend it together until it's a mushy consistency, and then you store it in the refrigerator, and it should keep for about a week. Then every morning you have your loved one take 1 tablespoonful and you drink a cup of a warm beverage of their choice. And then hopefully you give it at least a week, and then you can increase by another tablespoonful, and don't go over 4 tablespoonfuls, but you increase it as needed until you get the effect that you need. The most important thing here is to be sure that you drink enough fluids. I can't stress that enough. Fiber can almost be like cement in your gut, and that if you don't have enough fluid to mix with it, it can have the counter effect and cause constipation. So be sure that they're getting in the right amount of fluids. Skincare. So because of moisture, urinary incontinence is a common cause of skin damage. And if left untreated, skin damage can lead to infection and pressure sores. However, with proper skin care, these things can be prevented. The goal here is to maintain the health of the epidermis, which is the top layer of the skin, and you want to limit the exposure to irritants. So to keep the epidermis of your care recipients healthy, you want to use gentle techniques when you're cleaning them, avoid rubbing and scrubbing, or using harsh chemicals or soaps. Some other strategies that you can use are to apply a moisturizer to restore the lipids to the skin, and then use a moisture barrier to protect the skin from irritants. And examples of those are lanolin, petroleum, zinc oxide. The key here is to develop and maintain a daily routine for skin care. And then finally, if you do notice any skin changes, any new skin breakdown, you really should alert the healthcare provider of your care recipient as soon as possible so they can take a look at it and treat it in a timely fashion. Urinary incontinence product selection. So I'm sure, not surprising to you, there are hundreds of products on the market today. Generally speaking, when you're selecting products, here are a few rules that could guide your selection. Firstly, size. Be sure that the size and the fit are correct. Obviously, if the size isn't correct, if it's too big or even too small, there's a chance that there can be leakage around it and it can be ineffective. You want to pick the product that contains the amount of leakage that your care recipient suffers with the best. And if you notice that you're using a lot of products on a daily basis, maybe that could be an indication that you should look for a product that can contain a larger amount of urine so that you're using less of them. The time of day is also important. For example, nighttime leaks requires consideration, like bed pads, sometimes mattress covers to protect the mattress and the bedding, things like that. For some people, they leak more or less during certain times during the day. As I'm sure you have noticed, that guides the products that you select as well. Also, urine versus stool. There are some products that work better in controlling urine, stool, or both. I know a lot of times with older adults, especially frail older adults, they not only have urinary incontinence, but they have fecal incontinence as well. So I'd encourage you to read the packaging, the label packaging, to get some guidance about what product works best for urine, stool, or both. And then gender. Gender is always a consideration. There are certain products that are designed to capture leakages in relation to the male or female anatomy. So just be mindful of those things. So urinary incontinence product cost. Although we know that these products are extremely helpful, unfortunately cost is a major problem. Generally speaking, Medicare and private insurers do not cover the cost of incontinence products. However, if incontinence is listed as a medical diagnosis and products are ordered by a healthcare provider, they may be covered. So I would encourage you to talk with insurers for your care recipient to see if this situation could apply to you. Also, if your care recipient is entitled to VA benefits, the VA does cover the cost of incontinence supplies, which is something many people don't realize. Medicaid may cover some situations. Again, I'd encourage you to contact your local agencies for more information. But one approach, which seems to be one of the most cost-effective ways to get products, is to order bulk by bulk online. And you want to try to look for hospital grade because those are usually of better quality. That's usually the most cost-effective way that you can get those products. And then also grants. There are grants which may be available to you, which we'll discuss in the next slide. So who to contact? Here are a few suggestions. You can contact your local area agency on aging, also local Medicare, Medicaid agencies, and social services. All these places may have grants that you're eligible for to help you with the cost of supplies. And in preparing for today, I contacted a local agency, local Medicare agency where I lived, and discovered that they have a designated program for family caregiver called Family Caregiver Supplemental Support Program, and that's in South Carolina. And it is a grant. You go through an application process, but if selected, you get $550 a year for urinary incontinence supplies. And that's just me calling just with one phone call. So again, the take-home message here is to have you call around, be diligent, ask questions, and then no matter what you learn, it's important for you to share what you find and what you learn with others. So managing the stress related to urinary incontinence. As we know, urinary incontinence can be extremely stressful for you. To help with the stress, I think one of the first things is for you to be realistic and realize there are good days and bad days. And if you anticipate the bad days, hopefully they don't overwhelm you as much. With incontinence, it's the kind of illness where if things get better, sometimes the improvements may be very, very small. So it's important for you not to get discouraged. give approaches and strategies time, and then sometimes when you look back over a certain period of time, you realize how much progress and how far they've come. I'd also encourage you to take care of yourselves. Take a few minutes each day if you can to really calm yourself, calm your mind, and center yourself, because the more you take care of yourself and the better you are in terms of taking care of yourself, is the better you are or will be able to take care of your loved one. And then finally, don't be afraid to ask for help. There are many online resources available for you, but what I have listed here is probably one of the best and most comprehensive sites that I have found. It's the National Association for Continence, and we sometimes refer to that as NAFC. You have the website at the bottom of. They have additional information, more details on how to choose products, how to provide skin care. If managing odor is a problem for you, they have information about that, and they even have information about finding medical specialists within your area. So I'd encourage you, if you have any additional questions or you need some follow-up information, that's really a wonderful resource for you. So we've come to the end of our discussion today, but in closing, I just wanted to share with you one of my favorite quotes about caregiving, because I really think that it encompasses all that you do. You give little when you give of your possessions. It is when you give of yourself that you truly give. Khalil Gibran. So I thank you for your attention, and I'd be happy to answer any questions if you have any.
Thank you, Nicole. That was great information, and on a subject that's really not easy to talk about with friends and neighbors. So we appreciate your detailed information that you're providing. We do have a few questions, and let's go right to those. The first question is from Raymond, and the question is, my mother has dementia and goes to bed between 6 and 7 p.m. She does use the toilet before bedtime, and I wake her up between 11:30 and midnight to take her to the bathroom. Is this a good idea, or should I let her sleep through the night and deal with the wet diaper in the morning at 9 a.m.?
Well, thank you for your question, Raymond. That's actually really a wonderful question. Ideally, you would want a person to sleep through the night. I'm not sure if you're getting her up to toilet her because you're just concerned about her comfort. But if it's not bothersome to her and if her skin is okay, I would encourage you to allow her to sleep through the night. Now, in terms of other strategies, other than having them toilet right before bedtime, another strategy that we sometimes use in clinic is that if, for example, your mother, she has a lot of swelling in her legs during the daytime, sometimes that can indicate that they have something called venous insufficiency, where the fluid sort of pools where it shouldn't pool. And then what happens is when they lay flat at night, that fluid goes to their kidneys and causes them to get up and have to urinate. So one thing that you could do, if at all possible, is have her take a nap sometime during the daytime to allow any extra fluid that could be pooling in her legs to sort of let it work its way through her body during the daytime, so she's not having to get up at night to urinate. If she doesn't take naps during the daytime, what you could do, if you have a recliner or you have a chair where you can raise her legs up on pillows above the level of her heart, to see if that can help mobilize some of the fluids. And you know if this is a problem if before you put her to bed she has some swelling in her leg, and then when you wake her up in the morning to start her day, you notice that her legs aren't swollen anymore. So that's some sort of an indication that that may be a problem. But thank you for the question.
Another question, Nicole, from I believe it's Joy. How do you help maintain your loved one's dignity during this time?
Thank you, Joy. That's actually a great question. I think the first thing is to always remember that they're older adults and they're deserving of respect, and they're not children. You're not, trying to toilet your child, so to speak. So you always want to approach them in a respectful manner. You want to try your best to maintain their privacy in the bathroom, if at all possible. Sometimes some people have said, try not to refer to incontinence garments as diapers, because, an adult wearing a diaper can be a very stigmatizing thing. You can refer to it as an incontinence brief or something of that nature. And, approach things sort of matter-of-factly, but again, treat them as adults and try to maintain dignity and privacy as much as possible.
Great. Another question for you from Alicia. Incontinence and prostate concerns. A partner with dementia constantly wanting to go to urinate, but does not always go when they're taken to the bathroom. Is this normal?
That's a great question, Alicia, and you're absolutely right in thinking that prostate conditions can contribute to the ability for someone to empty their bladder, and then someone having dementia can sort of compound that. I guess the question would be whether or not they are refusing to go, or they can't, they're having difficulty emptying their bladder, or whether or not you think it's them just not wanting to go. When the prostate is enlarged, it can put pressure on the urine tube that drains the urine from the bladder, and that tube is called the urethra. And as a result of that, there's a lot of resistance for the urine to leave the bladder, which can cause some of these urinary symptoms and difficulty for them to empty. And at home, it's a little bit challenging for you to know whether or not it's related to the prostate or whether or not it's related to the dementia. So what you can do is take him in to have him seen by his healthcare provider, and or the next time you go, and express your concerns. There are medications that they can be placed on to help relax the prostate if he's not already on this type of medicine already, to relieve the pressure so that he's able to empty his bladder a lot more effectively. So I would, have him seen or take him into his healthcare provider and see if it really is a prostate issue, because the prostate conditions can be treated as well.
Nicole, another question from Raymond. Hospice nurses tend to recommend Senna tablets, S-E-N-N-A tablets, and imply that up to 8 tablets can be taken a day, and that the Senna tablets are not habit forming. Is this true?
That is true. I have not seen it dosed as high. The most I've seen is 2 Senna tablets twice a day. But if constipation really is a problem for your mom, I would again suggest trying that recipe that I had suggested, if you don't mind sort of mixing it up yourself to see if that is effective.
Great. A question from Lori Jo. Is there a booklet available with this level of detail? I'd love to be able to share this with other family members.
Thank you, Lori Jo. That website that I had posted before, the National Association for Continence, if you didn't get a chance to write that down, if you just Google that name, they've got a wonderful website with wonderful details above and beyond even what I spoke to today. So I'd encourage you to visit that site, and hopefully you can have answer your questions and have some additional information to share with your family.
You're doing a great job, Nicole. Another question for you from Jenny. After they go to a catheter, does that necessarily mean more bladder infections? And she cares for her mom.
Hi, Jenny. Thank you for your question. The type of catheter can sometimes determine the amount of infections or the predisposition to infections. There are internal catheters, for example, a Foley catheter that stays in the bladder, and there are also external catheters as well. And what we found is that just the presence of a catheter in and of itself can predispose a person to infection. But what you should try to do to decrease the risk of the infection, if you don't do it already, is just use just regular soap and water, and you care for the catheter at the insertion site, and then also care for it like as the tube further along the tube. But it's important for you to be sure you provide that daily care around the insertion site. And then if your mom does have an indwelling catheter that she uses all the time, another important thing is to be sure that that catheter isn't just swinging around. You want to maintain its stability, and you want to be sure that there's no tension on the tube, decrease a chance of it getting accidentally dislodged and causing other problems. But it can cause infection.
Another question from another Jenny, or Jeannie, excuse me. This was from Jeannie. My mother, this is a products question. My mother has dementia and wears Depends day and night. Recently I had to purchase plastic pants for my mom to wear at night because her brief is not sufficient for nighttime. My mom still gets up about 2 or 3 times. Any suggestions or product ideas?
That's a good question, Jenny. What I've seen some caregivers do, and you just sort of have to try to see if the situation works best for you, but sometimes what they do is they'll put an incontinence pad inside the Depends, and then change the pad overnight, so they're not having to change the full Depends, and that sort of decreases the amount of time they have to change everything. I'd encourage you to look at her, or with her healthcare provider, look at medication lists to see if maybe if she's on a diuretic or a water pill that's timed pretty close to bedtime, to see if that can be contributing to why she's going so much. Unfortunately, as people get older, there are changes that happen in the body that cause them sometimes to make urine more at night than during the daytime. And in our younger years, it's the opposite. So you may be dealing with the situation that's just a normal, normal for her in terms of her age. But you could try that strategy with the incontinence pad and the Depends, and then, perhaps look at the timing of her medication to see if that could be contributing to it.
Great. Another question from, I hope I'm pronouncing this right, Lynn, L-I-N-H. We found, and this is more of a comment I believe, but to maybe have something to add to this, Nicole, we found a great tip of using a urinal while in bed in lieu of a catheter due to infection. This is while our loved one had pressure sores from an institution. Any thoughts about that? And as well as, Nicole, another question we received, which was a concern about how to even recognize pressure sores and to make sure that they don't progress to a dangerous level.
Okay, thank you both for that question. And thank you, Lean, for sharing your comments about the urinal. And that's absolutely a wonderful approach. And we oftentimes encourage that to prevent the risk of falling down. Oftentimes when a person gets up at night to urinate, you can be disoriented even if you're young. So imagine being an older adult and you may already have some cognitive issues, to just go ahead and use a urinal just overnight to decrease the risk of fall. So that's really a wonderful strategy. In terms of recognizing pressure sores happen over bone, so where there's a bony prominence or a part where the bone sticks out naturally, like the hip, the tailbone, places like that. That's where pressure sores can develop. They usually start off with just a change in the skin where the surface of the skin is pink or slightly discolored. And when you press your finger on it, if it's not a pressure, so you would expect to see blanching or whiteness in the shape of where your finger used to be. And if you press and there's no blanching, then that's a sign that the skin is breaking down. Really, the only thing to prevent or to decrease the risk of pressure sores is the skin care that we described, to keep that skin clean and moisturized, but also to relieve the pressure. That's why, sometimes standing them up and getting them up to toilet, it sort of covers two things. It allows them a little bit of exercise to get to the bathroom. It relieves the pressure, sort of sitting for long periods of time, and then also it promotes emptying of their bladder. But the only real thing, like I said, to decrease the risk is to relieve the pressure. And pressure sores can go from bad to worse very, very quickly. They can start off looking sort of just a mild change in the skin, and then progress to, it's as deep as close to the bone. So if you're caring for them and you notice something and you notice that things start to get a little bit worse, I wouldn't hesitate to take them right in and let them be evaluated by a healthcare provider so it can be treated in a timely manner.
Great, Nicole. Another question for you. How can I know when I bring my family member to the bathroom that they actually have emptied their bladder? Sometimes I can't tell if the water color has changed or not, is what they said.
I know that one tip that Leah had mentioned before about that was something that a caregiver had shared with her, and he had given his wife vitamins that, just a regular vitamin, but he was able to notice a change in the color of the urine based on the fact that she had been taking the vitamins, because most multivitamins will sort of make your urine dark in color. Other times, sometimes it's sort of hard to know whether or not they go, and sometimes they'll go a little bit and then shortly thereafter they'll feel as if they need to urinate again, which could be just a part of the changes to the bladder as a result of aging or as a result of their urinary condition. One thing that we sometimes try is to encourage double voiding, which is when you take them to the bathroom, you have your care recipient go ahead and try to urinate, and then you stay in the bathroom, and then you wait anywhere between 2 to 5 minutes. Sometimes you can stay as long as 10 minutes in the bathroom and have them urinate again before you leave. And the key here is to have them attempt to urinate even if they don't feel the need, because that usually helps to facilitate bladder emptying if for some reason they're retaining urine in their bladder. And then hopefully that'll decrease the number of times you have to toilet them in such short intervals.
Great. And one more question. This one is, there's a couple of questions around this issue, which is they suspect that their parent who they care for has an incontinence problem, but it refuses to acknowledge it. But they smell a distinct urine smell, and but nobody wants to have the conversation. It's too uncomfortable. Do you have any suggestions, Nicole, on how to have those conversations?
Yeah, that's a really tough one. And sometimes just because of the stigma that's associated with it, they don't like the word incontinence. Like you can ask them, do you accidentally leak urine a little bit when you don't want to? Or that's one way we try to approach it as clinicians. Because then if you ask them straight out, well, are you incontinent? They're like, no, no, no. But then when you ask them if they leak a little bit, then they're like, okay, yeah, I do leak a little bit. It's just, sort of a play on words. But, you just have to, approach it, gingerly and gently. A very tricky subject.
Mm-hmm. Yes. Well, your whole presentation addressed, I think, a very tricky subject, and one that people don't often have an opportunity to discuss. So thank you, Nicole, for excellent information. And thank you, everyone, for your participation in the webinar, Moving Beyond the Leakages, Practical Strategies to Manage Incontinence. The presentation will be archived on the Family Caregiver Alliance website within a week. And again, that's www.caregiver.org. And the address is on the slide on Nicole's slides will be posted even sooner than that on the website. So you'll have those to reference. Please feel free to call us if you have any questions, 1-800-445-8106. And this concludes the presentation. Again, you will receive an email asking you to complete a survey. I know you probably receive lots of surveys these days, but we really appreciate you taking just a moment to complete this survey and share your thoughts. Your feedback is critical, and it helps shape the future of our educational programs. Again, thank you to Nicole for joining us, and thank you to all of you who participated, asked questions, and listened. This caregiver education webinar is now concluded.